Hey everyone, this is Victor from Cyborg for Life. Today we have a special guest joining us. He's recently completed his lengthening journey, undergoing femur lengthening with the internal stride nail. Please join me in welcoming limb length discrepancy patient, Bryan. Hey everyone, Victor here from Cyborg for Life, and today we have a very special guest joining us. He is a leg length discrepancy patient who underwent femur lengthening with the internal stride nail to balance his limb length discrepancy and finally ease his years of discomfort and pain. Not only has he had lengthening done, but he also had his lengthening nail removed a few months ago. Please join me in welcoming Bryan. Hey Bryan, what's up, man?
Hey, how's it going?
Doing good, doing good. So for those who don't know, a limb length discrepancy is when you have one limb shorter than the other leg. And this could be due to trauma or it could be due to a congenital reason, meaning from birth. And Bryan's going to tell us his story and how it all started. So Bryan, you had your leg lengthening surgery, I think we talked late 2019, correct?
Correct, September 2019. The lengthening went through late October of 2019.
Late October. Okay, gotcha. And, you know, I love backstories. That's why we start these interviews. So how did you end up with the limb length discrepancy?
Yeah, kind of like the limb lengthening journey. It's leg length discrepancies are many times a process. So I can't really aim to like at one point in time. I had an accident when I was 13. Mm-hmm. I did break my femur. I was skiing. I was an active kid, pretty athletic. Mm-hmm. And I broke the femur. I had the more traditional form of treatment, which was traction, where you go in the hospital, you put your leg up in the air, you see those pictures of the guys with the leg up there. You know, I was up there for about 6 weeks in that regard, with a pin through the leg and traction pulling on the bone to keep it straight. Wow. And after that, I did not have a discrepancy. So that was at age 13, but I had some knee injury during that accident, and then some subsequent knee injuries, and I had a knee surgery when I was 16. Mm-hmm. At that point, still didn't have a leg length discrepancy. But when I was 19, my wife, who was my girlfriend at the time, said, "Hey, you look a little crooked." And that's the first point I noticed it. So at that point, I think I must have had a spurt around the age of 18. So somewhere in all that trauma journey, that growth plate was affected. There was a screw that was put in right around the knee that probably had some effect. So again, kind of a journey, but that's how I ended up with it.
I gotcha. Yeah. Whenever, you know, those growth plates are traumatized in some fashion, it can really stunt the growth. In fact, that's what happened to me, and it happens to a lot of people. And there's a lot of people in the world that have discrepancies. They don't know about it, but yours was a little bit more in, you know, difference. And do you know exactly how big the discrepancy was when you were fully grown?
Yeah. Discrepancies are also kind of hard to measure, which you'll hear that too. You know, like people's, you know, when you get it, you might get a measurement and you get 2 or 3 different measurements, mm-hmm. Likely between somewhere around about 1.25 inches.
Okay.
Somewhere in that realms. I would lift my shoes 7/8 of an inch. Mm-hmm. Didn't start out with 7/8 of an inch, but you know, eventually got to that point. Mm-hmm. I started out with like 1/4 of an inch inside my shoe. When I was young, my body didn't really care. It was used to it already. As I kind of got older, my body didn't like not being even. Mm-hmm. So moved it to 1/2 inch. When I say older, I was probably 25, moved to 1/2 inch. And by the time I was 30, I was up to around 1 inch. And I kind of played with it until I got to 7/8 of an inch. And you don't necessarily have to have a shoe lift, or, you know, you don't necessarily have to do the whole thing. Mm-hmm. You know, so I ended up at 7/8 of an inch, which was a little bit less, mm-hmm. but it worked enough for me.
I see. Yeah. I did the same thing with the shoe lift and everything like that. And people do the shoe builds, and as long as you can shave that discrepancy down, it feels better. But like when it's over 1 inch, it's just like, oh my gosh, every day taking showers, walking on the beach, or just being barefoot in the house, it's, you know, it kind of sucks. So,
right.
Now, was your discrepancy all in one bone, or was it kind of like a little bit in the femur and then a little bit in the tibia?
Yeah, I always assumed it was always in the femur, and I'd had it, you know, a lot of times they do the measurements just clinically. You know, they have you stand on something and look to see how it is.
Right.
I'd done an X-ray early on, but and I forget what they actually said it was. But during this last surgery process, that's when they had the full X-ray done, and I found out it was mostly in the femur, but also in the tibia. So I think basically somewhere in the realms of 75% femur, 25% tibia.
Yeah. Wow. Yeah. Because I know for a fact that a lot of people, like mine, was not all in one bone, but then that can affect the knee being lined up with the other knee a little bit, and some people worry about that. Have you have you felt any type of difference with your knee measurements alignment?
Yeah, my knees were definitely off.
Okay.
So you feel that like when you lie on your side, you know how they don't line up the same
Yeah.
way. And so, uh, yeah, so it definitely kind of messes with biomechanics a little bit, not a big
Yeah.
deal.
Right.
So, yeah.
Yeah, yeah, that's one of the things, and it's more of like a kind of a psychological thing. It's just like, my knees aren't perfect, but as long as the hips line up, the spine and everything should be all good to go. Okay, and what type of physical pain did you have with a discrepancy like this? Because I know anything over an inch, I know you had to have some sort of physical, irritation.
Yeah, my back was always tight on my side, below my rib cage, between
Yep.
on the side, below the rib cage down to the hip. So
Hmm.
you feel those muscles just kind of trying to pull that sucker up, that
Yep.
hip up, and make it even. Um, and let's see, my back in the middle lower back, also hurt a little bit.
Yeah.
What I really noticed was, not every shoe was the same.
Hmm.
What I did do was go like you mentioned, Victor. I wore one shoe, especially in my later years. I wore one shoe a lot. I don't have it with me, but I had a flip flop, a soft rubber flip flop that was about an inch,
Hmm.
and I would wear that most of the time. Certainly around the house, I would go for walks in the neighborhood. People would be like, you're wearing one shoe. I said, yep, got it. Sometimes I'd have a little fun with it. Sometimes I'd be, but literally I'd go for a mile walk around the neighborhood, pavement, dirt, everything, just, with one shoe. So it felt the best.
Right. Yeah.
So, yeah.
That brings back memories. I did the same thing, and it's just like when you would walk around, people were like, "Wait, what?" It's like, "Hey, don't
Yeah.
ask." That's awesome. So, Bryan, when did you first hear about this lengthening procedure? Because it's not, not everybody knows about, leg lengthening per se.
Yeah. I looked at it pretty early on. Like I said, I was pretty athletic, especially when I was younger.
Hmm.
Now I'm not going to do as much as I was when I was younger. I'm almost 50, I'm 40, 48. But I certainly am active now. But we'll get to that later, perhaps. But when I was younger, that really limited me. With types of shoes. I mean, just things I would want to do, like bowling. You can't go bowling with a lift shoe. I mean, certainly you can invest in one. Things like ice skating, things like that sort of thing. But I looked into it when I was probably mid to late 20s, around the year 2000.
Okay.
I read about the Ilizarov.
Yeah,
Some
it
people
was
say
rough.
Ilizarov, some say Ilizarov. I don't know that one. I read about that and actually went pretty far. I talked to UCSF, University of California, San Francisco has quite a expertise in leg lengthening.
Hmm.
My own medical provider had a specialist that did it in orthopedic pediatrics.
Hmm.
So I talked to both of them. I talked to my own internal doctor. He said, yeah, you're a great candidate. I talked to UCSF to get a second opinion. There was a team of doctors, interns. They looked at me, brought in and said, yeah, let's do it.
Oh.
And so I had the green light to do it. And when you look at that cage and you think about the time it takes to do it, I'm not knocking the people. I'm giving props to the people that do it. I mean, it's quite a commitment.
Yeah.
I just said, I had young kids at the time. It would have been a pretty big disruption to life. Plus, it was just kind of a big, ugly, scary cage. So I said, no, I'm not going to do it.
Right.
So that was, almost 20 years ago.
Okay.
I kind of put it on the shelf, didn't think about it much. I'd heard about, some developments, but I hadn't really tracked them much.
Hmm.
And then I got a call from a company in early 2019 about a customer appreciation dinner
Hmm.
with a company called American Healers. I think they're the best in the business for shoe lifts.
Hmm.
Out of Ohio.
Yeah.
And I'd had their mailing list, but I'd never actually used them, which I should have, because I know they could have done a better job than the guys I had. So he calls me, leaves me a message, says we're having customer appreciation dinner, kind of just blew it off for a while, but sent me an email. Finally, he caught me one time. And so I went, and it was at a local restaurant. And what I found out is they teamed up with NuVasive. And part of this customer appreciation dinner was a sales presentation about Precice-Stryde. And I ended up sitting next to a guy who was in his mid 40s, from San Francisco area, and had the surgery done, had come to this dinner without even knowing that NuVasive was going to be there. He'd used the shoe lift company for years. Yeah. And so he got invited to the customer appreciation dinner, said, nice, free food, nice restaurant, let's go. So he went, and his story was so similar to mine. Yeah. And he'd had an accident in his teens. He hated shoe lifts. He did all the crazy things that guys with short legs do, or people with short legs do. He was telling me he bought 2 different types of shoes that had different, literally was running with 2 different types of shoes that had about, close to an inch difference. And he had the surgery, and he said to me, "You got to do it." Yep. So that was when I heard about it, and that's when I first started considering it.
Wow. Yeah. I know who you're talking about American healers. Ilya Romanov. He's the guy who built my shoe lift way back in 2010 or 11. And they do an amazing job. And in fact, I interviewed him months back, but that's really cool. That's awesome how it happened like that. You went to a dinner and it turned out that you got presented with the Precice nail and the leg lengthening surgery. So when you saw the sales presentation about the Precice nail from NuVasive, and you saw how this leg lengthening surgery worked, well, you already knew how it worked, but you saw how the internal nail worked. It was more, I guess, acceptable by you. Is this something that you're like, okay, I got to do this right now? Or are you still a little skeptical because they're still going to break your leg and lengthen it and all that kind of stuff? What was going through your mind?
Yeah. Like you said, since I'd already looked at it, I was aware of the process. The process isn't different from Lazaroff and this, you understand the process, you understand that there's going to be trauma. Right. But I walked out of that dinner, not expecting that, it was pretty cool to hang out in a room of 20, 25 people with short legs. That never happens. And that was like a cool event. And that's what I was expecting, you go like, wow, who's ever been in a room with 25 people that have short legs, right? So I expected that. So it was one of those real shockers. I remember my wife walking out from the restaurant, and we looked at each other and we're like, this could work.
Yeah.
Something we could really consider. So we did that. My life circumstances at the time, were that my kids were pretty much grown. Fast forward 20 years, pretty much grown. They don't depend on me at this point. I'm in a good, fairly good financial position. My job, I felt like I could take off some time. I've got good insurance. So yeah, we definitely said, yeah, let's look into it. So, definitely right from that moment went and starting fast forward on doing the quick research to decide what we're going to do.
That's amazing, because that's the same thing that happened with me. When I saw the Lazaroff and the frame, I was like, I got to get this done. I knew it was, something I wanted to do. But then when I found out they were doing Precice, because 2011, 2012, when they first released it, I was like, okay, let's do it. It sold me on just seeing that I don't have to wear this huge frame on the outside of my body. I don't have to get scarring again, because I had an external fixator, so I knew what it was like. So that's really cool that the internal nail kind of convinced you as well. So who did you consult with? Like, how did you end up finding the doctor that you decided to go with?
Excuse me. Yeah, I'm going to say it, Kaiser Permanente. It's an HMO. Okay. It's basically got a closed network of doctors. So I had a doctor at Kaiser 20 years ago, who I knew had been doing this. So the first thing I did was, I looked on the website. He's not in the same city as me, so it's a little bit of a drive, but I said, let's go ahead and book an appointment with him. I saw him on the website. So I sent a request. You have to get a referral. Mm-hmm. So I sent a request to my doctor and said, hey, can you please send a referral to this doctor? And I'd like to consult with him. So what happened in the background was he had retired within months of, this whole process. So he's still on the website, but he's not actually with Kaiser anymore. So in the background, they basically rerouted me to someone that they thought could handle it. So they sent me to, a very qualified trauma surgeon, but he'd never used Precice. Yeah. So it was interesting to get kind of the negative first opinion, because he wasn't a big fan.
Okay.
he had done some work, I think, with short stature folks in
Mm-hmm.
his interning. I think in Florida, I don't know who with or whatever, but he'd had some experience with lengthenings.
Mm-hmm.
I think more in the cosmetic nature.
Okay.
Trauma, I don't know what experience he'd had with that, but he'd never used Precice. So he was the one who gave me all of the complications that you could have, which certainly any surgery, folks,
Yeah.
any surgery, you can get your pinky worked on, and there's complications you could have, right? So he did give me the complications that, you could have nerve damage. Certainly if you're lengthening, you can have nerve damage. When you're putting a rod in your leg, certainly things can happen, right? Infections can happen, right? Any of these things can happen. So he was like, yeah, not a fan. And he was big on shortening the leg. And, when I pushed on that, first of all, people that have short legs don't, in kind of quote unquote, a bad leg, or, a leg that's not as good as the other one.
Yeah.
We don't want you touching our good leg.
Yeah, exactly.
Don't touch it, right? That's my good leg. So, that does not go over well in at least for me. I'm assuming that's not more universal. So that was his opinion. So I walked away from my wife going, wow, well, we definitely got the guy who, gave us, but he said he'd do it, but he'd never done it before. So it didn't walk away going, that's the guy I want. So there is, with NuVasive, they have I think it's called Reaching Your Height. There's a place where you can find a doctor.
Yep.
So long story short on that one, I utilized NuVasive to find a doctor in my network that had done it. And that doctor, totally night and day difference. When I talked to him, he was like, right from the get-go, said, you're a great candidate. I don't see major risk for you. He had experience with it. He had interned under a very well-renowned bone reconstruction specialist out of Cedars-Sinai.
Okay.
So, excuse me, he had a lot of experience with that in his internships. And then in Kaiser, as a trauma surgeon, he had used Precice. He's not, a guy who's using it every day, but he had used it a number of times. And I felt comfortable with his level of experience. I felt comfortable with him as a doctor, kind of a patient-doctor rapport. Mm-hmm. And at that point, my wife and I said, okay, let's schedule the surgery. I think I said, I'll get back to you. I think it took me a day. Yeah. And I sent him an email and said, I'd like to schedule the surgery. I think that was like in May or May-ish, April, May, somewhere in there. And I wanted to schedule the surgery in the fall, just from a timing perspective for my own life. But we did it, scheduled it, and started.
So you said earlier, that you did your surgery in October of 2019?
September
of 2019. Gotcha. And so what was the whole kind of few days of leading into the surgery, the day of the surgery? What were your nerves like? What was going through your head? You're going in for a leg lengthening surgery. You've heard about it, but now you're doing it.
I was excited.
Yeah.
There was, I think, you could look, I do have a YouTube channel we'll talk about later, but you could look, I did a day before, video or something like that. Maybe folks could watch. But I really wasn't extremely nervous. I think I told family, I remember telling people in the summer about it and getting the "you're doing what" thing going on, like you're going to do, like when you tell people about this, it's actually kind of fun, right? When you tell them you're going to grow, but you're going to break your leg and grow it, right? But, so I was kind of excited about it. I will say though, when it came to the day of, the moment of, that's when the rubber meets the road, and probably the nerves definitely hit in. I think I remember my surgeon, in the pre-op area, and there's a curtain around you, and I remember the doctor pulling the curtain back, and first time I'd seen him today, it's like, hey, how are you doing? You ready for this? And I think I remember him saying, I thought you were going to run out of the room. There's that moment when you're realizing, yes, they're going to put you out, they're going to break your leg. And, that was some raw nerves there at that point.
Yeah. Yeah, no, definitely. I know that's a similar feeling of when you see the doctor in the morning, it's like, okay, this is getting real now. So very cool. So, so you had the surgery, and, what did you have any complications during the surgery, or even the few weeks after the surgery?
No, no. I would say my process was smooth, just as expected. No complications from the incisions, no infections, nothing that was unexpected.
Yeah. So Bryan, leading into the surgery, you were an athlete. You did some physical activities and stuff. Were you worried that, the surgery is going to impact your ability to get back to what you like to do?
Yeah, I was super active as a kid. Even after the surgery, I had that knee problem, as you mentioned, or as I mentioned earlier. So I had a knee brace, an ugly looking knee brace back in the day. And I found a way to do a lot of stuff I like to do, even with that. And so I maintained that kind of rhythm throughout my life, that even though I had a shoe lift, I still tried to maintain a lot of activity.
Okay.
Certainly limited me, but one thing I really like to do, that wasn't high impact, was sand volleyball.
Okay.
I played a lot of beach volleyball. I had a beach court, or I have a beach court at my work.
Mm-hmm.
And pretty competitive. I'm not a tall guy, but that's the nice thing about beach volleyball is you don't really have to be.
Yeah.
But I was the guy on the court with wearing shoes, which no one wears shoes when you play volleyball. But I did, because I had a lift in my shoes. So usually those shoes were full of sand. That was one thing that that I would say that one reason, it's not certainly the only reason, but I wanted to have the ability to do things without these shoe lifts. And I thought that they would give me more opportunities. One thing about doing, I hiked and things like that, you're more susceptible to an ankle sprain. I think that makes a lot of sense. You're up on kind of a platform. If anybody wears heels, any females or males that wear heels, the point is you don't have the same solid platform. So yeah, I was looking forward to that.
Gotcha. And tight would you say that you got in your soft tissues during the lengthening process?
Yeah, I don't know. I definitely tightened up.
Okay.
It wasn't, I don't know how you can measure tightness, but certainly I was tight. And even now, I'm still working on flexibility. Okay. My calf is not as loose as I want it to be. My outer quad still needs some work.
Okay.
But it's not like you can't bend your leg.
Right.
And certainly, I know there's varying discrepancies that we're talking about here, and certainly, folks that are doing cosmetic, obviously, if you're going, you're 2 or 3 inches, I realize an inch is a far difference from 2 inches or 3 inches. Mm-hmm. But for those of you out there who are in that 1 inch length discrepancy area, 1 to 1.5, mm-hmm. You're going to get tight. You're going to have to work on it afterwards, but you can get through it. Yeah. I'm not the best guy at stretching and never have been, mm-hmm. but I'm confident I can get back to where I was. But, even now I've made a lot of improvement in the last, year.
Oh, that's awesome. Yeah, definitely. And it's always the fact that no matter how much length, it's like the body's just going to get a little tight, but it's all about just staying on top of it. And when it comes to pain, Bryan, how were the first few days? Because obviously the pain from the trauma, the surgery, that can be, pretty severe for a lot of folks. But how was it for you? What was your experience like?
Again, I'd say for a more detailed look, go back to my YouTube channel, look at the day or day after. You might see me a little drugged out a little bit, but I think I got the point across. After the surgery, you've got incisions, somewhere in that realm, that, maybe, what are they, about 2.5, 3 inches, mm-hmm. That you have up at your hip. You've got 1, 2, 3 incisions. So 1 for the screws at the bottom, 1 for the screws at the top, and then 1 where they put the rod in. Right. They're cutting your tissues, your soft tissues, and then they're breaking your bone. I don't know about other people, but I ended up with a bruise in the back of my thigh about that big, wow. Black and blue. I'm assuming that's from, kind of seepage out of the bone when it's broken. Right. Mm-hmm. So, and then I ended up, again, maybe this is different for everybody, but I ended up with a fair amount of bruising towards the top of the hip. So mm-hmm. those things add up to just normal post-surgery pain. So, but for me, I didn't take any heavy pain medications after I came home from the hospital. Of course, they send you home with, whatever pain medication of choice that they send you with. I don't remember which one, because I didn't take it, to be frank. Right. So all I used was Tylenol, wow. After I got home, except for maybe a little bit later, which we can talk about. But, but when, in the first couple of weeks,
Mm-hmm.
you know, those things are sensitive. When you move your leg, all those incisions are sensitive, right? Just any incision would be. So, you know, rolling onto the side of your leg or just moving your leg around, you know, I would have my care provider and my helper help lift the leg, you know, at the beginning, you know, so just that's how painful it was. But again, for me, you know, I don't know if I have it's hard to measure your pain tolerance, but I think mine's probably better than average.
Yeah.
But I don't like to take the narcotics unless I have to.
Right.
And I didn't. So.
Yeah, I'm in the same boat as you. I'm not a big person of, you know, taking those pain pills and stuff like that. And I think that you do have, you know, athletes tend to have a higher pain tolerance. So you being an athlete in your younger days stuff. So during lengthening, when you were lengthening the bone, you said you may have gotten tight and stuff. Did you feel after using the ERC machine to lengthen the rod, did you feel the tissues get tight, or was there any pain in the bone from lengthening itself?
I don't know if other people felt it. I kind of felt like an electrical little stimulation thing going on when I did that at ERC. I don't know if that was just me, like a little tingling a lot of times. I don't know if that was the nerves. Probably was. I don't know what it is. You know, that's the thing that people think is like when you're using the ERC, it's like it's going to be like being on the rack.
Yeah.
You know, like, you know, that's not really how it is. I mean, I was doing a half a millimeter twice a day. So I mean, that's the typical. You know, Victor, you're probably more of an expert there than I am, but you know, somewhere in the millimeter a day range is what you're aiming for. Maybe a little bit more, maybe a little bit less, maybe different times you're doing a little more or less, but that's about the cadence. That's just like I can't remember, a half a millimeter or a millimeter is 5 sheets of paper, but I mean, you're moving just a little bit. So what I would find is, you know, you would feel tightness definitely. And, you know, it just wasn't a ton of pain.
Yeah.
In the beginning, I would use a lot of ice.
Okay.
And that was mostly for getting the swelling down. You know, you have a lot of swelling. So in the beginning of my lengthening process, I used a lot of ice. After the swelling went down, I was using a lot of heat.
Okay.
And to me, I had one of those microwavable heating pads.
Okay. Yeah.
Before and after my lengthening, I was putting those heating pads on there to get those muscles nice and warm.
Yeah.
It just felt good.
Yeah.
So maybe that was my drug.
Yeah.
I use those a lot. I use those a lot, very much so.
Yeah, that's a great tip you just dropped for everybody to hear, because it's 100% true. When your muscles are warm and loose, they are a lot more pliable and easy to work with than a cold, stiff muscle. So that's huge, Brian. Nobody really said that before. I've never put that in my videos. So great little tip there.
And then on one more just note there. Sorry to interrupt you.
No, you're good.
And then you asked about the pain during the lengthening. There is a video that I have that you can look at. I don't remember exactly the point during the lengthening, but there was. So again, I did somewhere in the realms of 26.5 millimeters, 27 millimeters, somewhere in there.
Yeah.
And about halfway through, I think it was 13, 14, maybe it's 15, 16. I don't know, somewhere in the realms of half was when I had a couple of, I don't know, bad days, painful days. It was the only time I used a narcotic in the process.
Okay.
I don't know what, you know, basically your muscles your soft tissues got to the point where they're like, yeah, this is a little farther than I like to stretch.
Right.
And so there was a point where for about a day and a half to 2 days, I was in a lot of pain, you know, enough that I took pain meds. I was out one day, came back, and I don't know, I felt like I overdid it. I just think, I don't know if it would have happened or not, but you know, I was out and about, and came home and said, how, and ended up just lying around for a couple of days, pretty heavily.
Yeah. How long did your lengthening take? About 6 weeks or so?
Well, no, it was
closer to 8.
Just to describe that, and people may know this or not, but I mean, you don't lengthen the first week. At least that's what my doctor did. So they said, you know, basically, let's let you. I think they did use the RC in the operating room just one time, just like a millimeter, just to make sure it worked. Yeah. Make sure everything was working as well as they thought, and then basically no lengthening. So you start after a week, and then I think from there it was like 25 days, right? Because it was a millimeter a day. So maybe 25, 26 days. I don't remember exactly which one, but so you're talking about about a length. For me, it was a little over a month.
Okay, just a little over a month. Okay, yeah, that's not too bad. And after that lengthening phase, now you're into the consolidation phase. Did you notice that the pain and everything kind of subsided completely, or were you still stiff and sore in that, where the trauma happened?
For me, and again, this is my experience. I don't know if it's typical, but the way I think of it was it took me 1 month to grow.
Okay.
It took me 2 months for the soft tissues to heal.
Mm-hmm.
Right. That was really, and then that's when the recovery started. So for me, it was, I'm not saying you don't recover before then,
Mm-hmm.
but for me, it's kind of like if Victor, if I told you, you know what, I pulled my hamstring really bad, today I pulled my I go and, I'm out playing soccer and I pull my hamstring. I go to the doctor and the doctor's going to tell me, yeah, you pulled your hammy, probably going to say you need to rest up for 6 to 8 weeks. Right.
Mm-hmm. Yep.
I'm assuming that's what he's going to say. Right.
That is.
I think that's what I experienced with this, which is, kind of like having a bad leg day and a pulled muscle at the end. Right. So, or pulled muscles and tissues. So those 2 months for me after the growth was just for my muscles and everything to recover. And when I tried to do stuff, I couldn't push you got to listen to your body, and, younger bodies maybe are going to be a little better, but my body really wasn't ready to do much for those first 2 months after the growth. Like I remember, we'll talk about physical therapy later, maybe in this interview, but I remember going to physical therapy and having I didn't have an experienced physical therapist. We'll talk about that later.
Okay.
But he says, hey, let's see what you can do, and I remember there's usually a sink in the doctor's office, right? He's like, hold on to the sink, stand on one leg, and, see if you can do a little squat or something like that. And, whatever it was, I remember getting a real big shot of pain. I just wanted to see if I could stand on one leg, right? And I got that shot of pain through the quad, to buckle you down, right? Because just the muscles weren't ready for that, right? Yeah. So for me, it was that 1 month, 2 months, and then I started the recovery. That's really, was able to really much more heavily hit the recovery.
Yeah, that's true, because the soft tissues, like I've said in multiple of my videos, is that those are the ones that are they're trying to play catch up. The bone you can break a bone, lengthen it, and let it heal within, a finite period of time. You can almost predict that. Soft tissues, they can take a little longer, so that's really expected there.
And to your point, like as far as the bone goes, I don't know if you can feel a bone healing. I don't think you can. Right? So, the point is, people might be worried about, does your bone hurt? Does your bone during the process? I don't know about you, Victor. You tell me. I don't remember anything like that. That wasn't it at all.
No, the bone pain kind of like after the first 3 weeks being sore in that area, like I didn't really feel the bone itself. Like, okay, if I was sleeping and I jerked my leg a little bit, I'd be like, okay, that's a little stiff and, sore, but it was more the muscles. It was more the soft tissue. Obviously I didn't go running and sprinting right once my bone healed, but like, I didn't really feel the bone pain. I'm with you on that one, Bryan. Yeah, definitely. Yeah, for sure. So Bryan, you recently had your rod removed, I think a couple months ago. Can you tell us a little bit about that experience? And then also like, it's another surgery, so you had to go back into it. What was your mindset like? What was the physical pain like? Let's go through that.
Okay, but let's look at the rod.
Oh, you got the rod. Oh my God. I have
the rod. So I don't know how well that shows in the video.
That's the Stride rod, the internal Precice-Stryde.
Yeah.
Wow.
You can see the bend up there at the hip.
Yeah.
You can see here the screws. Those are the screws that go into the bone. Here's the screws that go in the bone. And if I bring it in, you can basically see that if I measure from that screw hole to here, you're going to find that if I had a ruler right here, you would find that's a little over an inch.
Okay.
This screw hole has moved from being right up against this to, a millimeter a day to move out to there.
Okay. So that's
just like a curtain rod, just like a rod within a rod, an expanding rod, it come out.
Yeah.
And, there you go. So this is, I don't know exactly what I do with this, but it's a fun little conversation piece and a momentum that is priceless in my book. My doctor was able to give it to me after I got it out.
That is so cool. That is like, so you can actually see how much length you got right there in the end. And now you have pretty much your journey right there in your hand. What is that, like kind of like a metallic gold? What color is that? I can't really tell if it's.
Yeah, it's just very silvery. I don't remember, you
That's awesome.
know, we'll talk a little bit later maybe about, I've worked with NuVasive a little bit, and just, I've kept in contact with NuVasive, and I've done some interviews with them. I think we talk about that later maybe.
Yeah.
But I talked to one of the engineers that came up. I wish I could remember off the top of my head what kind of metal it is. And maybe, Victor, I don't know, but it's not titanium. I think that's what they started with. It's
Stainless steel. I think they changed.
stainless steel. That's
Yeah.
correct. And a certain type, I don't remember. He rattled it off, but I don't remember. But it's silver, to answer your question.
Okay.
And obviously the change in the metal was what allowed the full weight bearing.
Okay. Yeah. That's awesome, man. You got the internal stride nail right there in your hands. That's super cool. I didn't get my precise nail. Come on, Dr. Conway. That's awesome.
Yeah, it was kind of fun. I was the question I asked, is it, doc, can I have it? He's like, I don't see why not. It's not like they're going to reuse it again. I can't sell this on eBay. No doctor's going to.
You can sell it. Just playing.
To answer your question, back to your question is, what was the surgery like and whatnot? And, I had my x-rays in July. So what would have that been? Close to 9 months or something like that. And, at that point, I think they say about a year is when you have it out,
Right.
That's typical. But, my doctor said, when we got the x-rays in July, he says, yeah, anytime you're ready.
Oh, okay.
So again, fall was a pretty good rhythm for me. So I did the surgery in October.
Okay.
COVID, of course, was a big curveball this year on everything. I had to get past the elective surgery ban, if you will, in California, which is where I am based out of. So I was ready to get this rod out. Not that it was like bothering you per se, but you just knew that was one thing that you had to do to get this done, completely done. Mm-hmm. And I didn't want to keep it in, I think you could, I don't think they recommend, but you could leave it in, right? But I wanted it out. So I got the surgery. I was just kind of like the first time, but even less so, just let's do this, right? Mm-hmm. So, there's no feelings of wanting to run out of the room when you're in the pre-op, you just want to get it done. But I didn't do a lot of research on what it was going to be like. To me, I was thinking, take it out a week, you're done. Let's play ball. But it was a little harder than I thought it was going to be. I think mostly just because you didn't psych yourself up for it. At least I didn't psych myself up for it. So you have the same level of trauma without the broken bone. Mm-hmm. So you've got the incisions. It's the same surgery. They're just pulling it out rather than pushing it in. And it was a little deja vu-y. It was a little deja vu-y. So, after surgery, you got the pain, hard to move around. You're like, crap, this sucks. But, there is a big light at the end of the tunnel. I think after 2 to 3 weeks, I was doing pretty well. But it took me, I would say, a good 6 weeks to really feel like it was fine. It's January now. Yeah. That was October. Now I wouldn't feel like I've had that surgery. It's completely healed. Wow. The hip, I don't feel anything at all on that. So I would say, whatever, this has been over 2 months and, no recollection. My body doesn't feel any problems or trauma from that. But it was, just for those of you who are going to do it, just make sure you get yourself a little psyched up, because it is a surgery, and it's going to have that sucky feeling afterwards a little bit.
Absolutely. Yeah. I had the same thing. It's like, I was like, oh my gosh, I had to go back in and get this thing out. And it's like, you think it's going to be a cakewalk, just slipping it out, but there's some trauma there, and it takes a good few weeks to get back from that. So Bryan, what's it like now? Like, you had the rod removed, you're recovered. It's January now. You feel great. What about right now? How do you feel?
Yeah. Like I said earlier, my muscles still need work. I'm not necessarily, I didn't hang out in the gym a lot beforehand. I'm hanging out a lot there, more so there now. Okay. But my muscles just need work now. Really, to me, with the rod out, it's just a matter of putting in the work. And I can run now. I feel like I can, could be psychological, but I feel like I can run better now after having the rod out. I just feel better. Honestly, I really do. Even after 2 months, I feel better. Right. But I need to work on my biomechanics. Mm-hmm. The biomechanics definitely change. I have an ankle that, if we had a picture of my shoe, the shoe's this thick, mm-hmm. Your ankle's rocking. It's got a much different biomechanical motion.
Yep.
Working on the heel to toe on your walking,
Mm-hmm.
getting those biomechanics in. I mean, I literally will get on a treadmill and not run, just do a fast walk and just work on my biomechanics. When I'm walking now, I'm working on that biomechanics just to get that normal motion there. So to me, it's just at this point, putting in the time, getting the muscle strengthening. I do a lot of, I'm starting to do a lot of spin classes just to get that muscles nice and strong.
Right.
But the great thing is, my body is ready to go. So after all this, it's just a matter of, just like anything else, if you want to lose weight, you want to get stronger, you can't just say it, you got to do it.
That's 100% true. I love that. And I love that you brought up the biomechanics for discrepancy, because a lot of people think, oh, the biomechanics are only for cosmetic patients. It's completely opposite. In fact, biomechanics are probably going to be more different for a discrepancy patient, because you were used to an inch difference for so long. Your spine, everything was kind of contorted to adjust that. And then all of a sudden you shift it back. Now you got to get used to the walking gait. I remember after I got mine done, I was almost tripping for the first few months, just like, whoa, my leg's longer. So it's true. And I'm glad you really mentioned that it takes training, balance training, proprioception a lot, and muscle strengthening. So that's really good. You brought that up.
Yeah. And I will say, like, to your point about, your biomechanics and your body and how it feels, my back is, night and day difference.
Oh my gosh, yes.
I mean, just your body just feels right, so, it feels right, though it's still trying to figure it out.
Yep.
I still, like when I would stand, I would typically, especially barefoot, I would put my, I don't know if maybe do this with help. I would stand with kind of like my heel up on my toes, on my right leg, which is my bad leg, my short leg. So I find myself, like when I go to brush my teeth or whatever, I'm standing and I'm like, what am I doing? Why am I up on my, like I really have to concentrate on all these habits that I've had for decades of how I compensated and say, no, you don't have to do that. I always kind of put more pressure on the good leg, all these things. It's like, you have to think through, like you don't have to do that anymore. So
exactly. Yeah. That's huge, man. I love that you brought that up. That's huge. You brought up the Stride nail earlier and we saw the design of it, but a lot of the earlier nails, like the Precice 1 and even the Precice 2, you're only allowed to weight bear like 50 to 75 pounds or maybe even up to 100, but the Stride, it can handle up to like over 200 pounds on each nail. What was it like to actually weight bear and get around and be more mobile during your process?
Yeah, great question. So I think that the Stride nail was, put to market in 2018 on a very limited basis, if I remember correctly. And then I don't know if the term is correct. I'm in software, we would call general availability, GA. I don't know if that's the right term for this or not, but I think it became available to the public at large sometime in 2019.
Okay. Yep.
I don't know if that's completely correct or not, but the point is, it's pretty new, and my doctor had never used it. So with a 1-inch discrepancy, he was pretty conservative on the whole, putting weight on it thing. And when you have one good leg, I crutched it a lot. So he was fine with me putting some weight, but he didn't really want me to. His recommendation was, basically don't walk on it with all your weight. Mm-hmm. I know that's not necessarily what Precice would tell you, and if you have two legs, if you're doing, a stature, lengthening, it's a different ball game because you don't have that luxury, right? But it was more, he just took the more conservative approach just because it was new.
Yeah.
And there wasn't a great need for it for me as a, we're talking about, when could I have walked? You can't walk the first week or two of surgery anyways, right?
Right.
After surgery. So you're only talking a couple weeks, right? 2 or 3 weeks of time. So what I did was, I did put some weight on it, not full weight. A few times I might have to get across the room, but for the most part, I wasn't putting full weight on it. Okay. And, I don't know if my doctor's changed his tune now that it's been, over a year, maybe he has, I think that there's certainly probably a lot of confidence in this rod at this point,
Yeah. Yeah. And I completely agree. I like your doctor's approach of being conservative with it because, you know, a lot of time, yeah, if you're getting stature length and you have both legs, but I think that being conservative and being safe is a good idea, at least early on during the distraction phase. So,
I have a story. I know my Precice on the Precice nail, which wasn't full weight bearing. You
yeah,
know, there was a guy when they come and train you how to use the ERC. There's a company that's typically involved that comes out and brings you the. I had the big uh, sidebar on ERCs. They're getting better. I just talked to NuVasive,
yeah,
and so there's a guy that let me finish the story and I'll get back to that. But they bring out this huge box. It's like a nuclear bomb case. Like where's the codes? And they bring that out, and he told me about a guy. He kind of had this slimmer thing. He'd never had a stride nail. It was the first one that this guy was involved with. This guy, he's the guy that was in the surgery as well.
Oh, okay.
And he'd never had a patient with a stride nail yet, I don't think.
Yeah.
Maybe I'm wrong on that. But he said he told me about a guy who used a Precice nail, that wasn't fully weight bearing, and he's like, this guy must have had the pain tolerance of Hercules. So he's like, I tell him, basically toe tap, not full weight bearing. He's like, the guy's just like walking like his legs, not broken at all. It's like just doesn't care. And sure enough, the nail failed. And he's like, that's the only nail I've ever known that failed. But the guy, he's like, he kind of deserved it, what I mean? But you were asking for it. So his recommendation was, that guy was the same thing. He's like, he couldn't give clinical advice, but he's like, you know what, if you don't need to push it, don't push it. Don't be like this guy.
Right.
But the nail obviously had come a long way. But just a quick sidebar on the ERCs. I did talk to NuVasive a month or two ago. And one thing about the ERC that is a little bit, takes some faith almost, is the way the ERC used to work, and I don't have it obviously, but it's kind of like a couple of big round magnets with a big handle. And you press it on your thigh. I've got a big thigh. They said, press it in there pretty hard because your thigh's big. Yeah. And you want to make sure it's making contact. Well, first of all, they literally put an X on your leg, and they say, put it here, right? And every day I'm like, I bathe and the X is kind of going away. I'm like, I want to make sure I'm hitting the X. So you're recoloring the X, stuff like that. But you're like, is it working? Right? Are you in the right place? If the magnet in the rod is here, if the magnet's here, are we aiming in the right spot? So one thing I said to them, I said, when I talked to NuVasive a couple months ago, I said, are you working on something that will sync and, some sort of indicator that says, hey, we're good. Yeah. And, the new ERC has that. They've got that apparently. So that's really good news, I think, from a patient perspective, just a clinic, experience of that ERC's A, getting smaller, and B, has a little bit more intelligence in it so that you as a patient are confident that it's doing its thing.
Yeah. I actually think I've seen a few pictures floating around online about, they have almost like an LCD screen that kind of shows that it's in contact and how much length it actually did and stuff like that. So I think they are improving on that. That's really awesome. Do you know which version you had of the ERC? Was it like the black one?
It was like the original model type thing. And from I don't know. I think the case was definitely black. I don't remember what color. It was definitely, it wasn't the purple.
It wasn't purple. Yeah. The newer purple color, the color of their brand and whatever. I think that's the one with the LCD, and it shows all those different data. So I think that's right along the lines of what you're talking about there. That's awesome. Bryan, I got to ask about this question. People have been really asking. In fact, I shot a video a few weeks about sleep during the lengthening process. That I know from my own experience, it's hard to come by. What was your take on that?
Yeah, same experience that you had, Victor. I will say sleep sucked. And for me, I'm a light sleeper. I'm also a roll around guy. So I'm going to roll 1,000 times during the night. So when you're having to lie on your back and you can't move easily, it's going to be hard. I use a lot of pillows around the leg, especially in the beginning, to kind of keep it from moving and tweaking and hurting. But for me, part of the game and part of the energy level thing we talked about earlier was especially the first couple of weeks. I mean, I was lucky to do a couple hours at a time. And it was a lot of like start in bed, wake up, go move to a chair, go move to a couch, just try to find a place to get some sleep. So there definitely was a point, a couple weeks in, I don't know exactly the day, maybe, 10 days in, something like that, 10 to 14 days, where I just hadn't had more than 2 hours of sleep at a time, that whole time, so you kind of get to the loopy stage, uh, so at that point in time, I think I tried some different ways, maybe some melatonin or whatever, those little over the counter stuff tricks, tried the tricks to try to get yourself to sleep. But I'm like, give me a sleeping pill. I got some Ambien, I just need to sleep some period of time. So I did cheat from a drug perspective. Not that that's cheating. I think the point is, at some point in time, if your sleep gets so bad, and we all know sleep deprivation is not a good thing for your body.
No.
So I just needed it. And I'm sure that if you're going through this, there's going to be, maybe you get to that point too, and do what you need to do. But I just was not trying to be dependent upon it. That's really what I like not to, I want my body to do its thing. So I didn't want to get to a point where I was dependent on that for sleep. So to me, I used it very sparingly, but when I had to have it, I did use it.
Absolutely. I mean, when it's time to hit that red button, it's time to hit that red button, because
Exactly.
It's going to help you heal. I mean, that's everything. So, and Bryan, what about like working? Because like obviously you mentioned you were in a good financial position and stuff, but like, did you go back to work after a certain time, or did you just completely take the whole time off? How did you manage that?
Yeah, especially with that sleep thing we just talked about, it would have been really hard for me to work. So I did take off the whole distraction period, and then a little bit afterwards.
Okay.
So, I think it was around 6 weeks that I took off full time, and then I went back part time.
Okay.
Could I have worked in there? It comes down to what you have to do. I mean, I'm not saying, it depends on what type of job, obviously, you have, whether you could work or not. But I was lucky enough to be able to take it off. And, from a sleep perspective, certainly during distraction, I think it'd be really hard for me. It would have been hard for me
to focus.
Yeah,
absolutely. Yeah, definitely 100%. All right. Now the big elephant in the room, physical therapy and rehab. So you mentioned a little earlier about your issue with your physical therapist and whatnot, but physical therapy is one of the biggest aspects of the lengthening process for optimal recovery. So I want to get your take on what your experience was with that.
Yeah. The physical therapist I had was great. Great person, just had never had a lengthening patient. So, and then I would say, I would say from a Kaiser perspective, it's not their strength, the way they do it. It's not it's more of the approach of, come in and we'll give you some exercises and then go home and you do them on your own. That's kind of the approach they take. They put much more of the burden on you. That's great for someone who's like really good with that. But quite frankly, I've been in enough physical therapy in my life to know that I'm not that guy. And quite frankly, most people aren't. So I know I've seen some of the more, centers out there that are doing this full time. They have a full-time physical therapy, and it's a huge part of the journey. Unfortunately, that wasn't the case with me. Like my physical therapy, it was kind of like, well, what do we do with you? And kind of training. In fact, I actually sent the video you did, Victor, to my physical therapist. But I was mostly done at that point. But I said, hey, you know what? I don't know if you'll ever see one of these again. But I think we had a good, good physical therapist patient, experience. I like the guy, and vice versa. And we had a good relationship. But he was just trying to understand what I should do. The doctor doesn't really, surgeons, that's not their forte. They cut and they do their thing, but they're not physical therapists. So he didn't give him any really, much to go on. So we kind of had to figure it out together. But it wasn't. I went once before just to say, should I do something?
Right.
They didn't really know what to do with me. They said, okay, here's some stretches. And then I didn't go. I don't think I went at all during the lengthening.
Oh, wow.
They didn't have me go at all, I don't think.
I'm shocked. Yeah.
Exactly. And then I started after the distraction, and it was like once a week, and then it was once a month. So A lot of this was on me. Yeah, a lot of this was on me.
I wouldn't say that. I think that the surgeon, like you said, it was a relatively, he probably didn't do a whole lot of them. And if they're not, used to doing a whole lot of limb lengthening procedures, they probably don't have a, like a really good systemized process in there. So
exactly.
Yeah. So that makes sense. That's cool. What it was the therapy, well, after you were done your lengthening, like stretching the hamstring, the posterior chain, like obviously that's gotta be thinking, was that painful for you at all? Not having done a whole lot of therapy? Were you
I
not?
would say that stretching per se, and wasn't painful, but as I mentioned earlier, like my muscles, and I don't know if it's typical, I don't know if it's my age or whatever, I don't know. I don't know how, I don't feel that I'm old yet, but I'm getting there. And I don't know how typical, what the average age is. That'd be an interesting thing to know. Like what's the oldest person that's ever done this? I don't know. I mean, I know when I found out about it, I'm like, you know what? I don't want to wait any longer, right? I don't want to be 60 doing this, right? But for my body, like my muscles or tissues, I guess it's muscles, they were just, they would give me some stabs of pain, like I said, I mentioned earlier, trying to stand on one leg, I really had to listen to my body as to what it was ready for. And, I'm sure that some people in much better shape when they started, or younger or would be able to do more than I could do. But, for me, yeah, there definitely was some pain in the muscles.
Okay.
And I would say, I call it really shots of pain. And that's true. Like it would just shoot up the muscle, like, yeah. No, I'm not ready for that. Right. No. Right. So I had to just kind of listen to the body and what I was ready for and not push it past that. I don't think pushing through pain certainly is something you have to do. Stretching, for instance, like stretching, you're going to feel some pain. You don't want a lot of pain, but you want to feel a good stretch, good pull on that. Muscle pain to me is a little different. Like if I'm getting a shot of pain, my body's saying no. So back off, do a little bit less, and work your way through it.
Yeah. And did you do any, like you mentioned that you may have done it just like once during the the healing phase, but did you do anything yourself, like go back to the gym or do type of things like therapy yourself?
Yeah, I was going to the gym. It's exactly what I did. So,
you did? Okay.
Like I said, I didn't have the therapy, but I went to the gym every day.
Okay.
And what was I doing? Going on the bike.
Yeah.
Working on my own little exercises. I think you'll see in some of the YouTube videos. You'll see me in kind of a yoga type room. Doing a lot of balancing.
Okay.
Did a lot of balancing type stuff where I'd be balanced on one leg and reaching down around a semicircle in front of me. I did a lot of that, right? To kind of keep that balance, down, up, around. Put cones or something around me, or just virtual cones. Just touch the cone all the way around me. So, yeah, my physical therapy again wasn't a formalized system per se. I mean, I had some exercises, but it was mostly me going to the gym. Luckily, it wasn't a COVID year, so the gyms were open. So I did a lot of that.
Yeah, that would have been a real hard thing if it wasn't open. But and Bryan, we all know that lengthening the whole process is a lot to deal with. Did you have any like support system in place to kind of help you cope with the whole process?
Yeah, shout out to my wife. She's the best. She was there by my side the whole way. So I definitely think whether you're stature lengthening or a leg length discrepancy, you're going to need someone, especially in those first few weeks, just to help get things, help move around, that sort of thing. But she was by my side. My kids are basically adults at this point, so when they were around, they helped as well. But that's very, very helpful. I think if you don't have something like that in place, you're going to have to hire someone probably to help for a while. But luckily, I had that.
That's awesome. Like, what did you tell people? What happened to you?
Yeah, outside of my friends and family, I just told a lot of people that I had a bone reconstructive surgery.
Okay.
From an accident when I was a kid. That's mostly for me, just for acquaintances that aren't needing to know per se. It was just it was an easy answer that didn't bring up the complicated story, right? not that I was not wanting to tell them. It's just, like you're walking by in the hall, what happened? It's like, you can't stop and tell everybody that, right?
Right,
So
right. Yeah.
it was more along, that was the storyline I had, was bone reconstruction.
Right.
That I had to have, which is, true, but it
History,
kind of
yeah.
shortens the story quite a bit.
Yeah, I said something similar, and I eventually told people that I had longer conversations, like the leg length thing. They're like, "Oh, what's that?" But I think the bone reconstruction can work for both discrepancy and stature, because you could have bow legs. You say, "I have to get this done," or rotational deformity. So that's a really
Yeah.
good tip there.
Yeah.
So, Bryan, I want to know, before we get to that, you said earlier that you had a interview, or you've been in close contact with NuVasive, and you've had a recent interview with them. Can you tell us a little bit about like what your interaction and engagement with them?
Sure. So I mentioned that there was a marketing gentleman who, was the one who introduced me to it, with American Healers.
Mm-hmm.
So he's been, very passionate about the product, and so it's kind of we've kept in contact via email and, occasionally text or a phone call.
Mm-hmm.
So he asked me if I would be willing to do kind of a patient experience with their company, kind of much like we're doing here, an interview.
Right.
Originally, it was going to be in person.
Okay.
He also wanted me to be involved with some of their kind of marketing, like with American Healers, kind of like a dinner type thing.
Mm-hmm.
COVID kind of changed everything, just like everything else in the world. So he had me do a Zoom meeting with, I don't know how many people were on the call. I didn't count, but basically it was anywhere from the president of the company to sales to marketing to manufacturing to engineering. A lot of people on the phone, and it was really just an interactive call about, kind of like this, my story,
Mm-hmm.
what was my experience like. The guy who was really involved with the Stride nail and making that weight bearing really wanted to talk about, how much weight bearing I did, what that was like, so, but a lot of it was just to kind of like get a sense of, we talked about the ERC, so a lot of the interaction. I mean, what I can tell you about that company is they're very passionate about this product. They're pushing it forward from a R&D perspective.
Okay.
Really impressed with that. I'm happy, I'm actually thrilled that, that's happening, right? That we can have a point where, this is available for people like me.
Mm-hmm.
That's why I did what I did, was in talking to you, Victor, talking on the YouTube channel.
Mm-hmm.
Just wanted to get the information out there. But I mean, you've got a company that's really invested in making this product better, which is just great.
Absolutely. That's really cool that they did that. And I like that because, that internal nail that they're creating is changing the game of limb lengthening. I mean, at least for people who just need it for discrepancy and stature lengthening, at least. Severe deformities, you're still going to need probably an external fixator or whatnot, but it is really flipping the script, and it's helping a lot of people change their lives. So that's kudos to them. And Bryan, so I want to talk a little bit about like you sharing your journey. You just mentioned you had a YouTube channel. So would you mind giving us a little bit about information on that?
Yeah, my YouTube channel name is long, but it's called Pulling My Leg, a leg lengthening journey with Stride.
Okay.
And Victor, I wish your channel existed before I did this. So the only kind of information that was out there that I could find, I certainly had, like for instance, NuVasive has their marketing material, but no offense, NuVasive, if you're listening to this, you want to hear stories not from a marketing perspective, right? Those marketing videos are great. I did watch all of them, but you want to hear kind of the real stuff too, right? That's not been through media, public relations, and all that sort of stuff. You want to hear the raw stuff. So you're trying to figure out what's going on. And really the best place I found for information was the Limb Lengthening Forum.
Okay.
Many of you might have seen that, be a part of that. I did chronicle my story on that, but that's primarily for stature lengthening. That's the primary, person there. So just a very few limb length discrepancy stories there. So I put mine on there, but I didn't feel like the reason I did a YouTube, the reason I did the chronicle on that was just to get information out there for people like me, the LLD folks.
Yeah.
So I was just wanting to get information out there for folks to be able to have, and it's very raw. It's certainly my YouTube channel is not edited. It's just me sometimes like under drugs in the hospital or whatever, walking around the house, hair not combed, not that I have any, but anyways, so that's what that was. And I hope it served that purpose. I've got, a fair amount of hits on that. I think hopefully it helps both people who are doing stature lengthening as well as the LLD patient.
Yeah, I think your channel, like I wish your channel existed when I had it done, because I literally had 3 weeks maybe to make my decision to go through with it. And if I would have watched your channel, like my ease would have been way through the roof. I would have felt much better, because you're really descriptive. Your stuff is literally raw, and that's what people want to see. They want to see the raw patient experience, and there's nothing better than your channel that I found for Discrepancy. So I'll definitely be sure to post the link there. And then Bryan, I know you've also been active with sharing your story and your information with other institutions and that. Can you tell me a little bit about that?
Yeah, I was off work. I'm doing this leg length journey, and quite frankly, it's pretty cool. You talk to people and you're like, you're doing what? You're rowing, right? So, most people work and have jobs and don't want to sit around and listen to me, watch me or anything like that. But I reached out to the local high school and just said, hey, listen, I talked to the anatomy teacher, I talked to the sports med program, and I said, hey, this is something you don't see every day. And, you guys do, a unit on bone growth. And I said, you want to see something, interactive, you want, so I talked to the anatomy teachers. I came in and did a presentation to a number of classes. I also went to sports med. People, in the sports med, they're thinking about being doctors, they're students, they're certainly not in med school yet. They're not even in college, but, why not spur on some, wow, what's going on in this whole biotech and, medical technology world. Maybe you don't want to be a doctor, but look at these other things you can do, right? So I went into there and I actually brought the ERC.
Wow.
And did a lengthening for folks, for kids. So that was fun, so a little way just to kind of, spread the, not just to spread some information and get some kids excited about hopefully doing something, not necessarily just this, but other things as well.
Yeah. So you went to these places during your lengthening?
I went during the lengthening.
Wow.
So I would take the ARC, and I did that with a class, and then some classes without the RC, but to talk about.
So cool, man. Look at you spreading the word about limb lengthening during your process. I mean, who would have thought that? Most people are like, keeled over in pain, and Bryan's going out there and spreading the word, man. Go on, Bryan. That's awesome, man. Well, Bryan, I think this is a really good, insightful interview. It's going to, open the eyes for a lot of people for leg length discrepancies and leg lengthening in general, from both the stature side as well, to get a glimpse of like all the different aspects that go into this process. So do you have any final words to anyone who's looking into getting limb lengthening done to fix their discrepancy or just to get the procedure done in general?
Yeah, I guess I'll just quote the guy that I sat next to in that first marketing press. I said, for a story like mine, if you have the means and the ability to do this, I'll say you have to do it. For me, I got no regrets. If you can do it, I would say go for it. Every story, of course, is different. Yeah. You got to consult with your doctor. This is like a one size fits all thing. But am I back? First of all, this leg was a little bit weaker beforehand. So I think I'm back to where I was. I want to go further, right? So I think this is going to be better than I was. So that's the opportunity that you have here. I'm not there yet. It's a journey. It's a marathon. This isn't like I have a surgery and it's all better, right? This is it's a year later and I'm still going forward. But I now can go forward, and I think it can be better than before. It can be stronger than it was before, and I don't have to have shoe lifts. Yeah. Anybody with a discrepancy knows you hate shoe lifts. Like you can't wear the kind of shoes you want. It's such a pain, right? So you got to do it. If you can, talk to your doctor, find out more information about it. And if the shoe fits, wear it, unintended.
That's so great, man. Bryan, I want to thank you for coming on and sharing your story. It's going to give a lot of patients and prospective patients hope and, just courage to go through the process, because it's really encouraging to hear that you don't have regrets, that you're an advocate now for the process because it changed your life. And yeah, you're only a year past your surgery. I can tell you from my experience that year 2 and on gets better. So you're going to see that your life gets better from this point forward. So thank you so much for coming on. All right, everyone, that is limb length discrepancy patient Bryan. Again, I'll post all of his contact information in the show notes. You can go over and check out his YouTube channel. It is super, super insightful. If you're thinking about getting the procedure done, you can see it from pretty much day one all the way through pretty much now when he had his rod removed. So Bryan, thanks so much for coming on. Have a good day. Yeah. Well, I hope you liked that interview with Bryan. As a limb length discrepancy patient who's finally had his years of pain relieved, it's great to have him come on and share his story so you guys can get a little bit more insight into what goes on in the lengthening journey. If you want to reach out to Bryan or check out his story in a little bit more depth, you can see a link to his YouTube channel in the show notes. Until next time, this is Victor from Cyborg for Life, signing out.